It was just 5 years ago that Dana Reeve, the widow of Christopher Reeve, died of lung cancer. She was just 44 years old, and I think what was most shocking for everyone is that she was not a smoker. It seems more and more often we're hearing about non-smokers being diagnosed with lung cancer. And joining us this morning is Dr. Tarak Mikhail. He's the medical director of thoracic oncology at Florida Hospital Cancer Institute. Thank you so much for being with us this morning.
Thanks, Amy.
First of all, talk to me about why this is happening, about why we're seeing patients who don't smoke who are coming down with lung cancer.
Well, it is more recognized nowadays. We have to start by saying, well, the vast majority of lung cancer patients are smokers. But we do understand now that lung cancer can happen in people who never smoked. And these individuals actually have a completely different disease most of the time. Lung cancer in never smokers behaves differently. And now we understand that actually it should be treated very differently.
Is it more treatable or is it about the same?
Well, it is more treatable in the vast majority of patients. We do know that it can happen because of what we call receptor mutation. And so far, there are 2 receptors that have been identified that you really can turn off with new drugs, like turning off a light switch. And these new drugs are very effective in people who have these receptor mutations, whether they are smokers or non-smokers, but most of them are non-smokers.
When we hear someone is diagnosed with lung cancer, we often think that it is an automatic death sentence. Is that still the case today?
Not at all, not at all. First of all, there are many stages of lung cancer, starting from stage 1 and stage 4. And even stage 4 patients now have many options of treatment. Some of them are what we call targeted treatment, where you really turn off the cancer cells without affecting the body. And a lot of people live for a very long time.
What do you want to say to smokers out there? Obviously, you see people afflicted with lung cancer every day. What do you want smokers out there to know? Well,
lung cancer is a preventable disease. That's the bottom line. There are many cancers that we can't do anything about, but lung cancer can be prevented by never smoking. And those who smoke, when they stop smoking, every day you don't smoke, the chances of getting lung cancer in the future goes down. So after a couple of decades, if you've stopped smoking, as if you've never smoked. So this is the one advice that, well, stop smoking.
And we're hearing a lot these days about secondhand smoke and third-hand smoke. You know, every time you see a parent light up around a child, what goes through your mind?
I think the impact of that is 2 things. Number one, secondhand smoking. The second thing is that many smokers are just sons or daughters of smokers. If you've grown up in a home where you've never seen tobacco, you've never seen cigarettes, the chances that you're not going to be a smoker. So a favor you do for your kids is don't smoke in front of them. And that actually will make them not get the habit. Number 2, will prevent the impact of secondhand smoking.
All right, well, it's definitely an interesting topic, and I'm sure there are a lot of questions out there from our viewers. So if you have questions for Dr. Mikhail, he's actually going to be in our web center all morning long answering your questions about lung cancer and smoking-related diseases. If you have questions, just go to myfoxorlando.com, then click on Top Stories, join our web chat. Thank you so much,
Thanks,
Dr. Mikhail.
Amy.
It's such a pleasure to talk to you. And again, he's going to be sticking around. All right, Michelle?
All right, Amy, thanks so much. We're going back to our Healthy Living segment this morning. We're, of course, talking about lung cancer with Dr. Mikhail here from Florida Hospital. So a lot of people are asking you questions this morning. So what are the big questions that are popping up?
Yeah, a lot of the questions actually came from people who smoked. And one question said, well, I've smoked for 20 years. Does it make sense to stop now? And can I reverse the damage? And my answer is absolutely. Number one, the effects of smoking is not only for prevention of lung cancer, and the benefit of stopping smoking on the heart happen almost instantaneously. I mean, a day or 2 after you stop smoking, the heart will benefit. But every day you don't smoke, the chances of getting lung cancer get less and less. And I would say by 20 or 30 years sometimes, after stopping smoking, your chances of getting lung cancer is almost like you've never smoked.
Really?
So absolutely, I would take that decision any day.
Okay, and I know that you were getting some other questions that were popular about whether or not it is a killer cancer. And what was your response to that?
Yeah, one question said, well, do all lung cancers kill? Absolutely not. And number one, there are many stages of lung cancer, and at earlier stages, lung cancer is sometimes very curable. And that's why we are working very hard for early detection. But now with the new developments and the new drugs, we have drugs that might actually change the situation also for very late lung cancers. And I would say that not at all, not every lung cancer kills at all.
All right, Dr. Mikhail from Florida Hospital, thanks so much for coming in. We really appreciate it.